A 30-year-old man has a liver biopsy performed after a night of heavy drinking. Findings are shown which of the following metabolic changes most likely contributed to the development of this patient's biopsy findings. Now, from this patient's biopsy, we can clearly see accumulation of fats in his liver cells, and this is going to be called steatosis. Another histological finding that is common in steatosis is going to be the nuclei being pushed into the periphery. So, if we have accumulation of fats in our liver cells, then these fats can actually push the nuclei into the periphery, and so this is going to give this histological finding that is going to be common in steatosis. Now, a lot of these symptoms that alcoholics experience are going to be caused by the fact that NADH is going to increase in the body due to the metabolism of alcohol. So, when we consume large amounts of alcohol, the enzymes alcohol dehydrogenase and acetaldehyde dehydrogenase are going to metabolize this alcohol, and when they metabolize alcohol, they're going to produce NADH. Now, high levels of NADH are going to be responsible for creating a lot of the symptoms that alcoholics and alcohol users experience. And one of these symptoms is going to be alcoholic fatty liver disease. Now, if we have high levels of NADH, then this is going to inhibit this reaction over here. So normally, triglycerides are going to be converted into fatty acids, and glycerol can then be converted into glycerol 3-phosphate, and glycerol 3-phosphate can then be converted into DHAP, which can then enter glycolysis. Now, as you can clearly see, the conversion of glycerol 3-phosphate into DHAP is going to use up NAD plus and create NADH. Now, if we already have high levels of NADH in the body, then this step is going to get inhibited, and as a result, we're not going to be able to oxidize fats in the liver. So this is going to cause accumulation of fats in the liver, and it'll give that histological finding that we saw on the first slide. Now, a lot of alcoholics also present with hypoglycemia, and the reason why this occurs is again due to high levels of NADH. Now, the conversion of malate into oxaloacetate is also going to produce NADH. So, if you already have high levels of NADH in the body, this step gets inhibited. And because oxaloacetate is going to be used in gluconeogenesis to produce glucose, we're not going to be able to produce glucose, so that can cause hypoglycemia in alcoholics. Now, remember that high levels of NADH is also going to inhibit the TCA cycle. Now, if we have inhibition of the TCA cycle, acetyl-CoA is not going to be able to enter the TCA cycle. So, in return, we're going to have this shunt to produce ketone bodies. And this is why alcoholics are going to experience ketoacidosis. Now, remember that in glycolysis, in order for glycolysis to continue, we need NAD+. And NAD+ is going to be regenerated from NADH in the electron transport chain in the mitochondria. Now, alcohol is going to damage the mitochondria, and this is going to ultimately reduce levels of NAD plus that the mitochondria generates. Now, if we have a reduction in NAD plus, then glycolysis is going to have a hard time progressing. So we need to have another way to reproduce NAD plus, and this is going to happen in this step, the conversion of pyruvate into lactate. And as you can see, the conversion of pyruvate into lactate is going to regenerate this NAD plus that we need in order for glycolysis to continue. So as a result, alcoholics can also experience lactic acidosis because we're going to have this conversion of pyruvate into lactate, which is going to regenerate this NAD plus. Now, if you go back to the previous slide, the answer is going to be answer choice A, which is going to be decreased free fatty acid oxidation due to increased levels of NADH within the body when we consume high levels of alcohol.